What if you're treating your tinnitus the wrong way? What if it's not age-related, but rather your body's attempt to signal a hidden health issue? What are you doing wrong if the ringing doesn't go away or keeps coming back? Maybe your doctor didn't consider everything that could be causing your tinnitus. Watch our video and learn how to eliminate ear ringing and avoid going completely deaf. Ringing in the ears can be one of the first signs of hearing loss or impairment, and it can only be treated effectively in the first 3 days. Sadly, many people find out too late, when normal hearing is already permanently lost. How can you avoid that? And how can you eliminate tinnitus at an older age and prevent it from coming back? On this channel, you'll learn about traditional methods and alternate medicine techniques to help get rid of persistent ringing and maintain healthy hearing. Today, I'll cover what makes the ringing worse and what reduces it, which medications cause buzzing and crackling in the ears, what exercise eliminates tinnitus in just 1 day, how can you get rid of the noise by changing your diet, which pressure point behind the ear can turn off ringing and squealing sounds, when should you rush to the doctor or risk going deaf, what to do if the noise doesn't go away, how not to go deaf from tinnitus, and how to restore normal hearing. I won't just tell you the causes of the problem, I'll give you a clear plan of action if ringing in your ears appears. And our channel expert will explain what to do about tinnitus to get rid of it for good. So let's start with the question, where is the ringing coming from? Any ringing in the ears, or tinnitus as doctors call it, is a symptom of an internal issue. A disruption in your body causes the sensation of ringing, buzzing, or humming in the ears without any external sound source. According to statistics, this type of noise occurs in about 10 to 15% of people, and the older you are, the more common it becomes. As we age, natural hearing declines happen due to damage to hair cells in the inner ear. These cells are highly sensitive and do not regenerate. So does this mean ringing, buzzing, or hissing in the ears is just a natural part of aging? No. While age-related changes are inevitable, tinnitus doesn't happen to everyone. Even at 70 or 90, you can still hear the world clearly and without interference. Here's an example. The famous conductor and artistic director of the Marlinsky Theater, Valery Gergiev, is over 70, yet his hearing, like his stamina, is phenomenal. This is a perfect example of active longevity. You can also hear as clearly as he does, sharp, clean, and without ringing. What does it take? Understanding the source of the sound. Before you follow advice from the internet, or put drops in your ears, or take something orally, you need to understand the cause to avoid harming yourself. So first, ask yourself, what kind of sound are you hearing? Is it a whistle, hiss, pulse, hum, or rustling? In a moment, I'll explain which issues produce which types of tinnitus. So, what kind of noise are you hearing? Tinnitus that only you can hear may come in different forms. It may be in one or both ears, constant or occasional. Some people describe it as the sound of wind, splashing water, or even a whisper near the ear. Any persistent noise in the ears definitely interferes with sleep, concentration, communication, and makes normal life very difficult. Tinnitus causes irritability and sleep issues. It can trigger headaches and blood pressure spikes. It creates a sense of anxiety and can even lead to depression. The most common complications are psychological and neurological disorders, anxiety, panic attacks, phobias, and in people with diabetes, tinnitus raises blood sugar levels because it increases stress. But all of this can be treated. We just need to understand why the noise is there and what to do about it. That's exactly what we're going to figure out. What's causing the noise in your ears? Tinnitus can occur for many reasons, including vascular, ear-related, and nervous system conditions. The most common cause is blood flow through the blood vessels. If blood vessels are narrowed, blood flows through them with difficulty and creates a sound like rushing water, similar to water being forced through a narrow pipe. You may not even hear noise, but instead a high-pitched squeal. Tinnitus caused by blood vessels is often pulsatile in nature. To get rid of this type of ringing, you need to address your vascular health. Some specialists believe that proper breathing is an effective treatment because it alters the balance of oxygen and carbon dioxide in the blood and brain. This affects blood vessel tone and the blood supply to the inner ear and brain. I asked our expert whether proper breathing exercises can help with tinnitus. If we're talking about patients with neurological disorders, then yes, breathing exercises are very effective in relieving tension and anxiety, which in turn helps reduce tinnitus. Tinnitus can also be a side effect of certain medications, such as antibiotics, non-steroidal anti-inflammatory drugs, some antidepressants, diuretics, and anesthetics. These drugs can negatively affect your hearing and cause ringing or whistling in the ears. The middle ear may suffer from otitis or other infections, which also cause hissing sounds. By the way, your ear may also rustle if water gets inside. But what is the most common cause of tinnitus as we age? The most common cause of tinnitus in older adults is sensorineural hearing loss, also known as neurosensory hearing loss. With this diagnosis, tinnitus is one of the symptoms of the condition. Patients typically complain of high-pitched noise, or as they often describe it, a squealing sound in the ears. It tends to bother them most in calm, quiet environments. Tension in the neck and jaw, or spasms in facial and chewing muscles, can also trigger tinnitus. When these muscles contract involuntarily, they cause vibrations that travel through tissues and bones in the inner ear. Because the chewing muscles are located close to the auditory system, the person perceives these sounds as noise, and stress can make it worse by increasing muscle tension. In fact, tinnitus can even occur only due to stress, without any actual problems in the ears themselves. Yes, I'm bringing up stress again, because when you're anxious, your body tenses up, muscles contract, blood vessels get compressed between tight muscles, and that's when the pulsating noise begins. During stress, your nervous system becomes like exposed wires, extremely sensitive, and you start hearing internal noises that you wouldn't even notice in a calm state. But in these moments, under stress and nervous tension, that a specific kind of tinnitus appears, neurosensory tinnitus, which seems to come out of nowhere. How can you deal with stress? Physical activity. Keep yourself busy. Do something or play sports. You can clean out the closet or storage room, go for a walk outside, or spend time in the garden. This distracts you from anxious thoughts and physically reduces stress levels. During exercise or physical work, your body releases hormones that improve your mood. But there's one catch. If you have vascular issues or chronic health conditions, intense physical activity may make things worse. Choose gentle forms of physical activity, such as swimming or walking outdoors. Try to stay calm and eat a well-balanced diet with all the essential vitamins and minerals we especially need at our age. For example, iron deficiency anemia, a lack of iron in the body, can also cause tinnitus. What else can you do to preserve your hearing in your silver years? Take care of your muscles and spine, and avoid head and neck injuries. Yes, problem with the cervical spine can also cause ringing in the ears. Let's talk more about that right now. Why does your neck cause tinnitus? Vital blood vessels and nerves pass through the neck, supplying the brain and auditory organs. With conditions like osteochondrosis or herniated discs, these vessels and nerves can become compressed, reducing blood flow and nerve signaling. As a result, the ear and auditory nerve receive less oxygen in blood, and that causes tinnitus. Neck exercises can help in this case. Try slow and gentle head tilts, forward, backward, side to side, and slow turns toward the shoulders. Don't move too abruptly. In this case, self-massage of the neck and collarbone area can be very helpful, as well as massage of the sternocleidomastoid muscle. This is a large muscle that attaches to the mastoid process on both sides of the neck. Massaging the area around the ears and the outer ear itself is also beneficial. But no exercise will help you in just one day, not if there's a serious problem. Any exercise needs to be done regularly. It takes time for blood circulation to improve. And you can help your body improve blood flow in the neck and head to relieve tinnitus. Just like with exercise, don't expect immediate normalization of blood flow or instant relief from tinnitus with therapeutic pillows or similar devices. Be patient. And if you can't eliminate the noise right away, can you at least make it less noticeable? Some experts suggest masking it, for example by using white noise or music to distract your brain from the persistent ringing. Let's find out if this is a good idea. Masking your own tinnitus is not only possible, but actually recommended. In many countries, there is a method called tinnitus therapy, which is widely used by patients with ringing in the ears. The patient uses a device that looks similar to a hearing aid. This device plays sounds continuously to help mask the tinnitus. These sounds can vary: white noise, ocean waves, or any other sound that the patient finds pleasant and soothing. In medical circles, masking tinnitus with other loud sounds isn't considered a good solution. Loud sounds, like constant noise, negatively affect your ears and nervous system. This can make the ringing or buzzing louder and longer lasting. So what else makes tinnitus worse, and which type of noise is the most dangerous? Let's find out. Caffeine, alcohol, and cigarettes affect blood circulation, and that means they make the ringing worse. An interesting fact: people who sleep poorly are more likely to hear tinnitus. The reason is that fatigue, like stress, interferes with the body's ability to ignore internal sounds. When you're tired, internal noise becomes more noticeable and louder. Now let's talk about the most dangerous type of tinnitus, the one that can make you faint. Tinnitus in older adults often signals a sudden drop or spike in blood pressure. With high blood pressure, hypertension, the blood pushes forcefully against vessel walls, causing a pulsating noise in the ears and floaters in the eyes. When blood pressure drops, for example, from standing up too quickly or from dehydration, blood flow to the brain is reduced, and you may hear ringing or hissing in the ears. It's also common to feel ear pressure, dizziness, weakness, and cold sweats. If you suddenly hear this kind of noise, sit down immediately to avoid fainting. Just as dangerous, and even more so, is tinnitus that comes with hearing loss. Have you heard of sensorineural hearing loss? This is a condition where hearing decreases, eventually leading to partial or total deafness. And this condition doesn't just affect the elderly. It often starts with a type of ringing that dulls external sounds. Sometimes the ringing disappears quickly, within a minute, but sounds still seem muffled or less distinct, like someone turned down the volume. And now, pay close attention, here's crucial information that could save your hearing. It is essential to start treatment for sensorineural hearing loss within the first 24 hours, or at least within 3 days, from the onset of tinnitus and hearing decline. You must not wait for the ringing to go away on its own, or for your hearing to return. Doing so can lead to permanent hearing loss. But if you start treatment in time, here's a real chance for full recovery. This type of hearing loss cannot be treated with folk remedies, no matter how effective they may seem. Don't waste time on ointments and herbal tinctures. Hearing can only be restored using specific hormones that are administered intravenously in a hospital setting. Age-related hearing loss, which may or may not involve ringing in the ears, is a slightly different issue. About 40% of older adults experience it. As we age, the eardrum loses elasticity, and the inner ear's hair cells gradually die off, which leads to hearing loss. Yes, we age, but it's not age itself that most affects hearing. It's health conditions and an unhealthy lifestyle. And you can slow down age-related hearing loss significantly. Just lead a healthy lifestyle. That means not only physical activity, enough sleep, and the ability to manage emotional stress, but also a balanced diet rich in B vitamins, vitamin D, and magnesium. This kind of nutrition helps improve circulation and supports overall health and active longevity. And remember, ringing in the ears can signal serious health problems. If it comes with hearing loss or changes in how you feel, seek medical help to find the cause and start treatment. About 10% of the world's population needs medical care for tinnitus. The rest manage it on their own. So what should you do? How do you help yourself at home if you have tinnitus? At home, reduce anything that might irritate your hearing further. Avoid using headphones. Keep the volume low on your TV and music speakers. And most importantly, calm yourself down. Drink some ginger and honey tea, for example. By the way, ginger improves blood circulation, which can help reduce tinnitus. Brew tea with a piece of fresh ginger and add a spoonful of honey. Lemon balm tea, Melissa, is also effective. Melissa has long been known as a great natural sedative, and we already know that stress worsens tinnitus. Melissa tea helps normalize blood pressure and may reduce ringing in the ears. Here's how to prepare it. Pour boiling water over a tablespoon of crushed lemon balm and let it cool to room temperature. Divide into 3 parts and drink throughout the day. You can add a teaspoon of honey for flavor. Many people say that the noise in their ears is so exhausting that they're willing to try anything to get rid of it. And that's when mistakes happen, like using unproven drops. There are no ear drops specifically for treating tinnitus. However, many patients come to appointments after having already tried various folk remedies they found online. As a result, in addition to the tinnitus, they also report new symptoms such as pain, a feeling of fullness, or irritation of the skin in the outer ear canal. You'll often find advice online suggesting you rub Minovizin behind your ears to reduce tinnitus. But does this method actually work? There is absolutely no connection between Minovizin and tinnitus. However, massaging the outer ears and the area around the ears can improve blood circulation, which may temporarily relieve the condition and reduce the intensity of the ringing in the ears. Want to know the simplest way to get rid of ear ringing? Massage. Remember, the main cause of tinnitus is stress and muscle tension. That's why massage helps, whether the ringing is due to poor circulation or stress. Our inner ear, responsible for hearing, is supplied by a single artery. If you improve circulation by releasing muscle tension, the noise may disappear. Let's relieve some tension in your muscles and ears right now. Gently press with your fingers, without too much force, on the points near your eyebrows. Next, massage the point under your nose. Softly press it a few times with your fingertip. Now try the area near your ears. Press and release. Press and release. Simple, right? This is an old Chinese technique for relieving tension and improving circulation. But there's another method, circular massage of a secret pressure point. Open your mouth and locate the tragus of your ear with your fingers. Find the small hollow above it. That's the spot. Keep your mouth open and massage the point. The motion should be soft and smooth, creating a warm and pleasant sensation. Massage this point in circular motions for 2 to 3 minutes before bed every night. And for those who don't trust Chinese medicine, here's an alternative set of ear exercises. Look at the screen. First, rub behind your ears in an upward motion. Be gentle but firm. Next, press your palms over your ears and rub in circular clockwise motions for 1 minute. And the third exercise, rub and knead your outer ear, thoroughly but gently. Important note, you should do these exercises every day for at least 2 weeks, even if the noise disappears earlier. Now you know 3 ways to eliminate tinnitus. 1. Acupressure. 2. Chinese secret point massage. 3. Vascular exercises. So, here's a typical case. If you're experiencing tinnitus, I strongly recommend starting your search for the cause by visiting an ENT, ear, nose, and throat specialist. Tinnitus is often caused by a buildup of earwax or the presence of a foreign object in the external ear canal. There have even been cases where the ringing was caused by a single pet hair near the eardrum. If the cause is more serious, additional hearing tests may be necessary, and the ENT doctor can refer you to other relevant specialists. What should you do the moment you notice ringing in your ears? First, clean your ears, but gently. Cotton swabs can damage the eardrum, so don't go deep. Just remove any visible earwax. Next, check your blood pressure, since we already know that fluctuations can trigger tinnitus. Then, review the instructions for any medications you're taking. Some have side effects like ringing. After that, do the neck tension release exercises I talked about earlier. And one more reminder, if your hearing has worsened, whether the ringing stays or goes away after the exercises, see a doctor immediately to prevent hearing loss. Remember, taking care of your health is the key to longevity, not just surviving, but truly living and enjoying life. Every day, try to make time for physical activity. Don't forget the importance of nutrition, and keep a positive attitude. Positive emotions help keep illness away. Don't forget to subscribe to our channel, where we not only share tips for getting rid of ailments, but explain why some remedies work and others don't. Stay tuned for new episodes. We wish you health and longevity.